Welcome back to the Connected podcast. In this special series, we step into the world of healthcare leadership through the voices of advanced practitioners working on the front line. From community clinics to acute care, these conversations explore what leadership looks like in real practice, messy, meaningful, and always evolving. In today's episode, we speak with David Monk, Associate Director for Allied Health Professionals. As an experienced leader in healthcare, David shares his perspective on situational leadership and what it really means to lead by example. Drawing on years of frontline and strategic experience, David reflects on the leadership models that have shaped his thinking and the moments when theory met reality. Okay, so welcome, David. Thank you so much for taking the time to chat with me this afternoon.
Thanks, Laura. It's good to be here. And it's great to be able to kind of share my experiences having completed the Milo module as part of my Advanced Practice Masters programme. So thank you.
Yeah, really excited to have you here. So for our listeners that aren't familiar, so our Milo module is our Managing Yourself and Leading Others, which is one of our core modules on our Advanced Practice programme here at UEA. And so I've grabbed David to have a conversation about kind of all things leadership and to talk a little bit about your journey. So just firstly, do you just want to kind of let us know a bit about your kind of current role and what your kind of professional background's been, sort of getting you to where you are now?
Brilliant, thank you. Yes, so I'm currently employed as Associate Director for Allied Health Professionals at Greater Peterborough Network. We're a GP federation, but not like most GP federations. We deliver at-scale services in terms of primary care at-scale services, virtual wards. We provide ambulance service advice line. We do urgent community response. We provide menopause services, services around supporting serious mental illness patients, and a whole variety of other things. So a not-for-profit NHS provider, essentially. Prior to that, I'd been the Executive Clinical Director for St John Ambulance in Wales, whilst living in England. I was the first individual appointed to the role. There wasn't an individual in that post prior to my appointment. And then prior to that, I'd been 10 years just about at a large acute tertiary hospital where I'd looked after urgent and unscheduled care. Prior to that, I'd worked at a different hospital looking after essentially anything that wasn't elective within the hospital, including site operations, the emergency department, a variety of other things. And then my time prior to that was working for the ambulance service. I did 9 years in the ambulance service, started off as a student paramedic. And the time I left, I'd been head of operations for Cambridgeshire and Peterborough. So a variety of things. And what I always strikes me is some of that I'd kind of chosen as a deliberate career pathway. Other bits and pieces I'd fallen into, perhaps accidentally, or someone had given me a nudge and said, "You're really good at that, go and apply for it." But I always say to people, particularly if I go and speak to undergraduates or people not sure about what they're going to do in their career, I always say to them, I left school not knowing what I wanted to do. I knew when I left school at 18, I didn't want to go to university. Ironically, I've cut the masters now, an honours degree, part of the Open University Business School Council, other things. So I've gone back to academia, but at the time I wasn't sure what I wanted to do, and I think I've now reached a niche combining being a clinician, but also working in a leadership role and bringing that clinical authenticity to what I do. So I've always said to people, no matter what I do in my leadership role, I'll always make sure I've got hands-on patient contact every week and remembering what brought me into healthcare and the fact we're here for the patient, and I don't want to lose that.
Yeah, so inspiring. And I think that is such a great journey for, learners or people that are at the beginning of their careers to think about what they can aspire to be, and that actually no journey has one set path, and there's different ways to, perhaps get to these new jobs, but the landscape's so evolving all the time that actually some of the roles that we might aspire don't even exist yet, which is where I think it's really exciting. So this is going to be great because you've got so much experience and a very unique pathway in lots of ways to share with us today. So I wonder, you've talked about some of those decisions, perhaps, or those career decisions being more intentional than others, and some perhaps, you fell into. obviously you've ended up in a very kind of high leadership levels and done a lot of leadership throughout your journey. Have there been any particular kind of leadership models that have resonated with your practice, or anything that's you've particularly felt helpful as kind of a theory? Or did you feel that just kind of aligned with kind of more of your kind of personal values? Tell us a bit more about that.
It's a really interesting one, isn't it? Because, all the way through my career, I've always said, and it's a bit of a cliche, but treat people as you'd expect to be treated yourself. I've never asked anyone to do anything I wasn't prepared to do. So when I worked at Cambridge University Hospitals, I remember one Saturday something had happened in the A&E waiting room. There was blood everywhere. We had to shut the waiting room at one point while it was clean. And I remember one of the site matrons coming round to find me and then saying to the porters, "Oh, where is he?" And they're like, "He's cleaning the waiting room." And they came round and I was literally scrubbing the floor myself, because at that point in time, that's what the team needed me to do, was to get things back on track for them while they were looking after the patient. And I wouldn't expect someone else to do that if I wasn't prepared to do it. So there's a bit around leading by example, isn't there? There's a bit around treating people as you'd expect to be treated yourself, not asking someone to do something you wouldn't do yourself. But on the flip side, yes, theories matter, and things do change. And I remember when I made and I guess the one I probably subscribe to most is that kind of situational leadership. I remember I moved from working for the ambulance service to working in a hospital. My first 3 months were not an easy journey, because I'd come from an environment where it was just quite hierarchical and quite almost command and control by the nature of being an emergency service. And I'd come into an environment that was predominantly nursing orientated. And I was the first non-nurse appointed to the role I held in that hospital. And again, nursing had a different leadership style and was quite, far more collaborative based approach, far more around building those relationships with people, and that transformational approach rather than that transactional or command and control approach. And I got quite a bit of feedback in my first couple of months from the nurse managers that I was responsible for, saying, "We know you mean well, people aren't warming to you, and we know you're a really caring, supportive individual," because they've known me throughout my career in the ambulance service, starting as a student paramedic. But they said the style you're using just isn't working in this context. So I had to learn to use a different style and become familiar with that and comfortable with that. And I did, and that's perhaps now the more comfortable style I use, and one that sits better with me as an individual. But I also remember that as the COVID-19 pandemic set in, we had to make some quite difficult decisions and some quite quick changes, as most settings did. And I was working at Addenbrooke's at that point in time. My deputy had come from the prison service, and I had quite most of the time used that, relationship building approach to then make decisions, make things happen. And we had to redesign how we were delivering services during the pandemic. We had to actually move out an entire service from a part of the building to move our ED miners into that space, because we needed to create more resus space, etc. And one Tuesday morning at 8:30 a.m, we called a whole variety of people from across the hospital together, people that I wouldn't normally work with. And because we had to do that over a space of 3 or 4 days, I became very much something my deputy had never seen, which was a command and control approach, which was very much, "This is what we're going to do. We need you to do it. You're representing cleaning. I need this to happen. You're representing estates and facilities. We need this to happen. This is the deadline. You're here representing the carpenters. Right, we need this done, that done. Catering, we need this. Infection control, we need this." And my deputy came out and said, "Wow, that was amazing. You got everyone to do something, despite the fact you don't really know them in terms of close working relationships. And they all signed up to do it. And I've never seen you like that before." And I said, "Well, I can be like that, but it absolutely is the context that matters, because that's the style I would have taken at a major incident in the ambulance service and did when I held gold and silver command roles, or a large scale road traffic accident. But that's not the context and way I'd normally work, because that's not the style that normally works. Because actually, to build meaningful relationships, to make services better for patients, and to transform how we do things, I've always, since moving away from the ambulance service, used far more of that relationship based approach and that transformational approach. So I think you're absolutely right. There are models that work, but those models for me are context specific, rather than being, "This is how I do things all the time." Because to get the most out of people, I've found that situational based approach is the one that works for me.
Yeah, and it sounds very much that because of those very particular scenarios and situations that you're in, having to adapt your leadership style has been fundamental to your success, actually. But winding back, because there was just so much insight within that reflection you just gave. I'm just wondering, how it felt actually at the beginning of your journey, being somebody new in a role. Like you said, there'd never been a non-nurse in that role before, so that can feel pretty incredible but daunting and slightly terrifying, starting a new kind of job role anyway. But then to have that kind of feedback about, well, actually, it's not landing in the right way for your team. That must have been pretty difficult and challenging. So I'm just wondering actually how, because I think for us to grow and for us to grow authentically, sometimes we do have to have, that feedback that perhaps isn't easy to hear, and perhaps we're not, when we perhaps go for, say, like a 360 feedback and we're like, okay, I'm feeling robust, I'm ready to go for this, you kind of armoring yourself, right? But sometimes you're getting that feedback perhaps on a day where you've already had a bad day, you're feeling a bit stressed about the new role. I'm just wondering how you coped in that scenario, and whether there's any kind of tips and that golden hindsight that you would share with with people.
I think humility is important. I perhaps didn't think so immediately, and I remember someone saying to me prior to joining the NHS that actually feedback's a gift. And at the time they said that to me, it didn't land. But over time, you begin to think, actually, do you know what? That's right. It's a gift in terms of how I can improve to help others. And for me, it's then about being able to do the best I can to help others do the best they can for the benefit of patients. I think a bit of humble pie, and I remember sitting down with the band Six Sisters, and I've just used a phrase that I always curse people for saying. Why in the NHS do we refer to people by their pay band? But there you go. To sitting down with the junior sisters and having a conversation to say, look, I've got it wrong, I haven't got it right, and I'm determined to get this right. Help me to help you, and that was how I approached it. And we built a great team over the 5-6 years I was there. And I remember having to have a period of time off for surgery, and I remember coming back into the hospital just prior to coming back to work on a phased return. And one of the junior sisters stopped what she was doing, which actually was in the middle of taking a handover about a patient, and saw me and came running up to me and gave me a hug. So I thought, you know what, I've clearly made that impact, I've made that difference, I've got that mutual respect going, and it just, you realize you've landed how you wanted to, and you've made the impact you wanted to. And it's not easy, and sometimes we still have to make difficult decisions, or decisions that people don't necessarily like. But if you got it right, they'll still respect those decisions because they'll know they've been done for the right reasons.
Yeah, and sometimes, obviously, as the leader, sometimes you're delivering the unpopular message from on high, and it's not what people want to hear, but it's perhaps, the situation due to, the pandemic, or the resourcing, subsequently. And it's challenging, and it's holding, I think, sometimes, isn't it, space for your team to react in the way that, you probably did when you first heard the news. And remember, I've said to other people, it's remembering that, the biggest resource and the best resource we have is our people in the jobs that we do, our patients, our staff, the whole system. And actually, we're just humans. So sometimes we just need that little bit of space and time and care for us to get on board with essentially what can be a jarring kind of action that we need to take forward. Would you kind of agree?
I'd agree. I think you hit the nail on the head there, Lauren, around the greatest asset or resource is our people. And having managed volunteers as well, that's an entirely different approach, isn't it? Because actually, for me in the health service, I'm motivated by doing the right thing for patients. But also it pays my mortgage, it allows me to go and have nice holidays and do the things I want to do. And that's probably true around most people that work in healthcare, isn't it? Then you think about volunteering, and the vast majority of people are doing it for altruistic reasons, and because they get that real sense of purpose and reward and belonging that comes with that. But it's an entirely different way to engage with volunteers and work to motivate them, because their motivation's different. So it's absolutely about knowing the teams that you're working with and what motivates them, and understanding what their vulnerabilities are, or what will make them worry, or what's going to be a difficult thing to do, and then making sure that you pitch that message in that way.
Yeah, and it's interesting, isn't it? Because I suspect that working with those different teams, so your volunteers or your kind of staffing groups, that there are elements of insight that really benefit each group based on what the other group has kind of said. So with the volunteers, actually, you mentioned there about it giving them that real kind of sense of purpose or a sense of belonging, and actually our staff groups will really benefit from us growing that as a community as well. So I think there's lots of trade-off there, isn't it? And it's sometimes as us as leaders, it's about kind of being very perceptive to the different perspectives that different teams bring, and then working out actually which bit of that's going to really benefit this team, or there's a challenge there, how can we kind of think outside the box to overcome it? Has that been your experience as well?
Yeah, absolutely. I remember during the pandemic, I actually ended up in a great position whereby, not without its challenges, having our St John volunteers doing clinical work in a hospital for the first time ever.
Wow.
And actually bringing together those individuals who wanted to help patients and get that sense of belonging, alongside our employed NHS colleagues, to all do the same thing, was just an incredible achievement, and one that spread to 39 hospitals across the country as it grew, as the pandemic grew. But actually being able to get both groups working together in a shared way for a shared vision and purpose was amazing. But the rewards came in different ways. So the St John volunteers were all saying to me, it's great, I've got a purpose, I've been furloughed, I want to do something to help because I know how bad it is. And actually the best thing we did for them, in terms of making them feel part of the team, was to do something that wasn't official, as in regulation St John uniform, was we got them green scrubs and had them embroidered with the St John logo, because then they appeared very similar to their NHS colleagues who were doing a slightly different thing but caring for patients, and that gave them the sense of belonging. And they weren't asking for pay at the end of it. And then we had an afternoon tea for them, and we got little pin badges that said thank you for COVID-19 support, we couldn't have done it without you, which a local company sponsored. But actually that was far more meaningful for them, because that's what gave them what they wanted, as a sense of purpose and belonging and motivation. Whereas for my NHS teams, it was around, they wanted help, they wanted to do the right thing for patients, and they wanted leadership that no matter what was going on in that changing context for 2 or 3 years, was someone saying, we've got you, we'll make sure that you're looked after, we'll do all we can to make sure that we keep you as safe as we can. And as we find out new things, or we get those latest government updates at 5 p.m. on a Friday, it always was 5 p.m. on a Friday, wasn't it? We will make sure that as soon as possible, we've interpreted that in a way that then we support you to change your practice or do the next thing. Different context in terms of what people wanted or needed, but still making sure we're all together for the patient.
Yeah, absolutely. And something you mentioned there a couple of times around for the those volunteers and that sense of belonging. It's that interesting, isn't it? That sense of belonging mattering. Slightly different kind of concepts, but actually how you bring that together is so powerful for those individuals. And I love that actually bringing that uniform, it sounds like that really helped foster that identity, which then built on that kind of sense of belonging, mattering, and being part of that big team, all striving, as you say, for the best outcomes, keeping people safe, looking after patients with that shared vision. And that can be really difficult to create when you're working across multiple teams. And again, it's finding the kind of the heart of what is it that we are trying to achieve, which for us as healthcare professionals is pretty much 99.9% of the time better or improved care, doing the best we can do, being the best that we can be for our patients. So yeah, that sounds incredible. And I wonder then, with all those different experiences and going back along your journey, whether your kind of your view on kind of leadership, or that's changed, or it's progressed, or perhaps been quite challenging at times.
I remember going for my first Band 7 interview in the ambulance service, and I wasn't successful. And in fact, I wasn't successful the second time. And then the third time I was. And one of the questions I perhaps fell down on at that first interview was someone saying to me, is there a difference between leadership and management? And if so, what is it? And I remember saying, no, they're the same thing. But actually, they're not, are they? Management is very much around a structured way of doing things that are set to a process, a SOP, whatever it may be, and that's how we do things here. Versus leadership being that vision, that almost that presence, taking people with you to get to where we all want to be. And I think definitely during the pandemic, that was what we needed to do to support our staff, and particularly with implementing the St John clinical volunteers into hospitals, when I got everyone saying, you can't possibly do this, but actually this is the vision, and bringing teams across the hospital and then across the country together to make that happen. Absolutely, for me, showed yes, there is a difference. And which am I more comfortable with? I still don't think I've actually worked that out in my head really, whether I'm more comfortable as a manager or a leader. Again, I think it depends on the context. So yeah, I think that was one of the real realizations in my career journey, and my leadership journey particularly, is around starting to understand that difference.
Yeah, and that's so powerful. I think that reflection again, and very honest. Thank you for sharing about, the fact that we can, and I think it's so important, particularly perhaps for our younger generation coming through, that you can be top quality and still not be successful for that job, because at the end of the day, you might have three candidates that are all amazing, score the same on paper, and for this particular role or context, someone else pitched to the post. And so building that resilience and knowing that you've kind of got to keep going is really really important. So thank you for sharing that. And again, that honesty about that question. And I completely agree with you that there is that difference, and I always see it as, managers being very much the builders. So they've got a plan, they are doing the day-to-day, making sure that everything is being built, you're following the regulations, the rules, and it's being done. And that leadership being those architects, so they're the ones that are kind of mapping it out, looking at what's needed, what's going to work really well, and what can we aspire to be. So that analogy really chimed with me when you were talking there, because I was like, yes, that's exactly how I kind of see that difference. And it's so difficult when you're not, people will often come, you've probably heard it when you were doing the module as well, where, and again, going back to that hierarchical, I'm only a band 5, so I'm not a leader. Oh, I don't have management responsibility, so I'm not, I don't do leadership. And it's like, whoa, all of us are leading, whether it's that porter that's leading the cleanup operation to make that environment safe again for us to work. Everybody has, a chance to lead in their team. So it just really reflected on what you were saying there.
I think you're right. It's that personal quality and then bringing it to play in the environment you're in. I remember doing my MBA, and quite long, 13, 14 years ago now. I remember doing the residential school for one of the modules, and obviously we were a whole variety of different industries, because I deliberately didn't do a healthcare specific MBA. I did a generic MBA, and actually there's people from around the world as part of it. And I remember going to the residential business school, and someone saying at the end of it, well, none of this has taught me how to be a leader. I thought I was going to get training. And thinking back to myself, well, I think the idea is you have some theories and you understand concepts and what motivates people, but can you teach someone in a weekend how to be a leader? No. You can give them the building blocks, but it's that natural ability, but also you build on it with time, experience, particularly experience, and feedback, to then grow and become that leader. And it's not something you can teach overnight. And I bumped into that individual a few years later, actually, in a completely unrelated environment, and they decided that actually that wasn't a journey they were going to continue on, and we're doing something completely different, which was probably the right decision for them. So perhaps they didn't have insight at the time, but then developed that insight and reflection.
Yeah, and I think you're absolutely right. And I think as human beings, we don't know what we don't know. So we start on the journey, and I'm always, anybody that takes any of my modules knows I come up with crazy analogies all the time, but I'm always saying, like, is everybody on board the bus? and some people don't even know they need to get on the bus. Some people are up the front ready to navigate and take it, take the wheel. Some people are sitting on the back seat, messing about, having a chat, not really all that bothered. They're happy to be on the bus. They don't really care where it goes and which direction, which path. There'll be other people that are kind of challenging all the way. Well, we could get there faster if we did this. Or then you've got the people that are trying to put a pin in the wheel and slow you down. And it's this whole collective challenge with leadership, isn't it? But you've got to embrace, I think, as humans, and again, if you're facilitating staff or learners, whoever on their journeys, is recognizing, isn't it, like where people are right now. So again, for that person, okay, so they wanted to have kind of an A to Z of how to do leadership and a guide, and okay, so they need a couple of tools and strategies, get a bit further along, and then perhaps then can start thinking some of the other content that we might look at. But until, I think, as you were talking about earlier, until you've got some of that kind of leading by example, keeping your hands dirty, if you like, but getting stuck in and still doing the day to day, and those situations, those examples, that experience to build on, it becomes really difficult, I think, to learn what your style is, what works, what doesn't, depending on different contexts, different people. Like, it all lands so differently, doesn't it, all the time? Definitely a challenge.
And it's funny because someone asked me earlier today, actually, what's the culture you create? And I just talked about, high quality standards, holding people to account, being patient focused. And then I reflected actually on International Paramedic Day this year. We did some profiling on social media at work, and then we worked with the College of Paramedics to share it. And someone who actually been my line manager back 15 years ago, if not more, actually no longer than that, maybe 20 years ago, commented it and said, "You've forgotten to mention that you make it fun." And that was a really nice comment, actually, that actually, despite the fact we work in a serious context, working in the health service, and we're all really focused on the right outcome for the patient, we can still make it fun, and we can still value the contribution people make, but actually we can do it with humour and good spirit as well. And actually, I smiled when I read that comment, because actually it's quite true. And you can bring humour into a lot of things in the right way, and it can make it far more comfortable for people and make people feel far more like they're welcome, and it's the place they want to be as well.
Yeah, again, building that sense of belonging as well. And I think the jobs that we often do, there's no point pretending it's not hard, and the resources are often not enough, but as you said, and I remember learners again, when we've talked, they'll talk about being that mood hoover in the team. So I think you're absolutely right, to be positive, bring that energy as best we can, to have that little joke at the end of a shift to kind of bring the humor back after something difficult. Like you say, there's always time and a place, and as professionals we know what's appropriate. Sometimes we don't always get that right, and that's a learning curve as well, but absolutely keeping things fun. And I think, again, as remembering that we're humans and we need that to thrive, is super important as well. So I just wonder, as we bring kind of our conversation to a close, I just wonder what advice you would give to any kind of emerging leaders about kind of maybe learning from that theory, or, the limitations of relying too heavily on the theory when they're in the healthcare sort of setting and in clinical practice. What would be your kind of advice and top tips?
I think it is about using the theory, but then growing with experience. And I remember interviewing someone for an 8A role, an operational leadership role, and they'd clearly gone and done a number of management modules within, I think, probably a master's program, but hadn't got any experience. And asking them questions and scenarios, they kept saying, "Oh, I'd use this, I'd work in this way," and they were naming the theories. But what they couldn't tell me was how they would apply it into reality, and how they would deal with the scenario other than, "I'd use this theory," right? But it's great to use that theory, but how do you apply it into practice, and how will that get you the outcome we're looking for in the right way? So I think it's about using that as a foundation, and then building upon it. And at the end of the day, don't lose sight of what you're trying to achieve. And I think that's what I said at the start, wasn't it? Is the bit around we should be here for the patient. And if we're doing something that there's no benefit from for the patient, then why are we doing that? And I remember you just a little while ago, Lauren, we were talking about the difference between manager and leader, and you were talking about managers follow the rules, etc. And I was smiling inside because I'm the first person to break the rules. If I don't think they add value, and I don't think they're going to make a difference to the patient, or I think they're getting in the way of doing the right thing for the patient, then I won't follow them. And if I can get a better outcome for the patient, providing it's not illegal and not going to cause problems with regulators, then actually that's what I'll try to do, and try and then change those rules so it's the right thing, and it's doing the right thing for the patient becomes the easy thing. And I remember being on a ICB wide steering group last week, actually, where I'd been on a weekend in a clinical role, and I'd asked 2 services to do something for a patient, and neither had got capacity in isolation, but both had got capacity if they'd come together, and the clinicians on both had the skills that were needed, but we couldn't possibly do that because we're not employed by the same organisation. And I remember feeling really frustrated, and I brought it to the leaders of those organisations on that ICB steering group last week and said, help me out here, I'm really struggling. This patient didn't get what was needed, despite the fact between us we'd got what they needed, and instead we sent them to hospital where they're going to decondition, be at risk of falls, healthcare acquired infection. And it was quite an interesting conversation because a couple of us said, well, that's not what our policy says. I said, right, can we just rewind, move the policy to one side? How do we do the right thing for this patient? And actually everyone agreed we should just have done the right thing, and we need to change the policies to allow it to happen. So I guess I'm coming back to the point around what would I say to people not to forget or to remember is do the right thing for the patient in our context. Or if you're working in a different sector, do the right thing for the customer. So if you're working in a support service in the NHS, who is your customer? So, HR or finance or whatever, procurement, your customer ultimately is your colleagues who are delivering services to patients. So what do they need to allow them to do the right thing for patients?
I love it. And I love actually that message of let's just challenge the system, because sometimes it just takes someone, we all get slightly entrenched into like the way it's always been done. So I think that, being brave to challenge and being courageous to suggest. And I love actually the way I think the language that we use and the attitude we use to do it is really, really key. So I love that I'd really like your help. I'm struggling to understand, why has this gone wrong, instead of marching in, this is ridiculous. And I think that is so powerful. So I think that, again, staying authentic to yourself and, why you're here, why you're doing that, challenging the system, but doing it in that really, respectful and the way that actually you are open to learning, that I think is really, really powerful. So, David, it's been so wonderful to talk to you this afternoon. Thank you so much for your insights. I know that they're going to be really powerful for our listeners and our learners. So thanks again, and you take care.
Thank you.
Thank you for listening to the Connected podcast. If you enjoyed this episode, please check out the rest of our healthcare leadership series and stay connected.